We're in an era where digital health, maternal health companies are really moving fast and winning contracts. Do you see home visiting nurse-led models having an edge where these more modern iterations don't?
So, home visiting and our evidence based programs, they really help bridge the divide around access to care that happens in a doctor's office with an opportunity to be able to create trusted relationships to support both medical care from a physical health standpoint, but also from a mental health standpoint with our two programs, Nurse Family Partnership and Child First. And it creates those trusted relationships because you're invited into a home of somebody who wants to not only improve their health, but improve their opportunity for improved well-being for themselves as well as their children and their family.
And so, do you see partnerships with tech as a way forward there, or is that there a risk of losing what makes these models unique?
No, I think there's absolutely an opportunity to partner, but I think the difference is in where we have an ability through these kind of programs to make real systems change as we think about the broader level of healthcare is shifting the conditions that hold the problems in place. And so we know that 80% of what matters for health happens outside those doctor offices, right? They happen in the homes, they happen in schools and jobs and communities. And so in addition to looking at the physical and mental health, how does health tech, and it's not an either or, it could be an and plus, right? How does health tech provide that space to ensure that those trusted relationships, which are outcomes in themselves, because we see trusted relationships tied directly to an opportunity to improve ROI, to improve health outcomes, and therefore improve the societal longitudinal healthcare, long-term healthcare and social outcome needs. And so in programs like home visiting, which sits really not only on evidence, but it's really driven by those trusted relationships, I'm all for technology. I'm all for tech to help improve what we know, to improve efficiencies. But at the end of the day, where does health tech play a role in terms of relationship building with that patient or that client? Right? Being able to look them in the eye and understand what their needs are, what their issues are in terms of the family, seeing what's happening around the home, which has implications on how they're experiencing their current health and other social needs, being able to hold their hand or give them a hug, right? So I think there's an opportunity to bring technology into the fold from an efficiency and understanding outcomes a bit better. But where is the interplay and where's the interaction to providing, and if you want to think about community and redefining community, bringing it back to a personal level, right? Bringing it back to the relationships. And so how can technology and health technology ensure that we don't lose sight of that, because we're not dealing with widgets, we're dealing with people. And every one of those data points is an important data point. It's an important outcome, but each one of those is a mom, is a child, is a caregiver, right? So how do we ensure that we're acknowledging what's happening in front of us and with us with a technology that can inform how we can be better?
How does bridging nurse family partnership and child first together under one umbrella change what you can accomplish?
Yeah. And, as I said, that, 80% of what matters with your health happens outside the home. And so Nurse Family Partnership, it pairs a registered nurse with a first-time mom prenatally through the age of 2 years old. And that nurse, this is free, that nurse provides not only the clinical support, the medical support, but also looks across other issues that mom is experiencing, whether it's mental health, whether it's understanding how do you find a job, how do you pay your rent, really looking at that whole person And Child First as well looks at it from both the child and the caregiver as a dyadic relationship, because it pairs a mental health clinician and a care coordinator. So you're really looking at the dynamics that are happening in that home and in that family. And so being able to look at not only the person for their medical or mental health needs, but looking at how is that person able to thrive? How is that person be able to grow within the family and ensure that there's long-term health outcomes, right, that impact the trajectory of their, of living the life that they want to lead.
So, what does the shift to change it represent for yourselves and for the field?
Well, the shift for change in is that we partner with a lot of different types of organizations that actually deliver our programs in the field. And those partners can be community-based organizations, public health departments, big hospital health systems. But when we think about healthcare in general, healthcare has an infrastructure, especially big health systems have big infrastructures in terms of IT, clinical infrastructure, safety protocols, and everything else. But what's missing is the prevention, that prevention infrastructure. And so where models like Nurse Family Partnership and Child First make a difference is it makes a difference in terms of ensuring that the costs that we're paying for down the road in terms of outcomes that aren't what we want to see are prevented upfront. And so prevention, and including prevention as an infrastructure in the entire healthcare system, is important because it does translate to ROI. And prevention is not just about being compassionate. It's not just about saving lives. It really is a good business decision. It is a smart strategy, investment strategy for society as a whole. And when you look at people and hear them, value them, they feel respected. At the end of the day, that unlocks their potential for longer term health and well-being. And being able to do that earlier up front, there's a Nobel winning economist, his name is James Heckman. I don't know if you've heard of him, the Heckman curve, where he documented that there's a 13% savings back to society by investing in early childhood. And so when you think about home visiting programs that can provide $13 back for every dollar spent for programs like ours, every healthcare leader, every policymaker, knowing that information, preventing that up front to be able to save $10,000 a day in NICU costs, saving, $2,500 on visits, right? And being able to invest that instead of the costs that are happening now and early on, being able to invest it upstream, right? To be able to change those systems. And where prevention and intervention programs like this make a difference is reducing what happens long-term in terms of societal costs.
So would you say that, we'll just talk about Nurse Family Partnership for a minute here, but does it, inside of the continuum of care, where does it sit? Is it just, it's not just, but is it prevention, or is it care management, maternal health, or would you say it's all three?
It sits not only in terms of medical and mental health support, but it does sit in the space of looking at all of the drivers of health, right, that impact the health and well-being of a child and a family. So, for example, when I talk about that ROI, right, I mean, we're paying for the outcomes that we're trying to prevent, right? And so the question is, do you want to pay for it in those expensive hospital visits and NICU visits, or do you want to be able to invest it in upstream? So Child First, for example, there's a 40% reduction in child welfare involvement. It's evidence-based, it's documented. Nurse Family Partnership, a 56% reduction in ER visits. So that's preventing those really expensive costs that are happening with big health systems earlier on. So preventing those, so the percentages of, in terms of reduction of those issues and those costs that really eat up profitability for health systems, being able to ensure we reduce those so we can invest those in places that make sense further down.
Well, I also noticed that on some of the outcomes reported, a lot of them line up directly with CMS stars and maternal health priorities like the immunizations, the breastfeeding, the developmental screenings. Is that intentional?
Yeah, that's part of the original RCT trials, those outcomes. And so, for example, Nurse Family Partnership has 45 years of evidence and research to back those outcomes. Child First, over 20 years of research for those outcomes. So that's what good looks like, right? And those are important outcomes, but the difference in the ability to impact the systems and communities and families at a broader level is taking those outcomes and laddering them up to a business strategy. So there's a connection between the two because outcomes are important, but sometimes they're just not enough. Impact is really, really hard to demonstrate. But when you can connect a through line to an ROI, right, upstream, and how prevention and intervention impacts that, that's what good looks like. It takes those outcomes and it makes a difference at a societal level. And so you're not only just improving that individual patient and child and mother or caregiver, you're really impacting society. So you can take those costs that impact upstream in a different way, right? You're not solving for problems that you could have already solved earlier.
Makes sense. And I know that a nurse family partnership has been called the gold standard when it comes to maternal child health programs. Um, how do you balance fidelity to the model with adapting to new state or payer demands?
Yeah, that's a great question. I mean, sometimes we hear sometimes that, our programs, for example, over 40 years of research, right? Could that be dated? How does that reflect in today's communities, right? And actually saying that we have over 40 years of evidence and research is actually very innovative because it not only takes what works, scaling what works, but also being able to at the same time overlay what's happening in your community, what's happening with the family. The dynamics of the community today don't always reflect what happened 20 years ago, right? And so how do you look at them both together, scaling what works, looking at the outcomes that we know inform better decisions for parents, right, for the system itself, and then looking at how do we then adapt those models in a way that build off of what works and centering community and families for today's context. And that is something that we know is important to ensure that we get those outcomes of that societal ROI, but also ensuring that we stay relevant.
Well, definitely makes sense. I mean, in a market full of new maternal health startups, when you have and you're able to show that decades of trust and longitudinal data are behind you, do you feel like that puts you at an advantage, or do you find it difficult to still communicate your impact?
No, I think it does. It is definitely an advantage because these programs, they're grounded in evidence, but they're driven by relationships and they're driven by trust. And it gets to sort of that first question that we talked about around that technology first. And we're helping to ensure that as we think about how do you define community? I mean, if we want to be, wouldn't it be great to be better off if we redefine community and leaning more into those personal relationships and physical connections? Because we know that that's what impacts longer term health and well-being, right? And looking at the whole person, digital, those digital connections, finding the information, being able to be more efficient is wonderful. But there's no digital substitute for trust. Trust is really an action verb for the work that we do. Because again, those relationships where the families that we work with, they're in the deepest end of the ocean. And a lot of times they're experiencing fear, they're experiencing anxiety, they're experiencing sadness, maybe it's anger, right? And so developing a trusted and dependable relationship, you can't replace that with a digital component. So yes, I do think that makes a difference because the relationships are really what drives these models, not only with families, but in the community.
Is there anything about the Nurse Family Partnership's long history or anything about the mission that personally drew you to this role and let you know that this is where you needed to lead?
Yeah, absolutely. At the end of the day, I've had a sort of a nonlinear career, but my career has always focused on relationship building. It's always focused on understanding the community that I'm in, but at the same time, also looking at how do you make things better? How do you help people in terms of that service mentality? How do you just help ensure that things are better off? And so that's what's so wonderful about these programs. And if I could share, a couple of stories, because this really, we have all of the data, the outcomes, but it's the stories that really matter in terms of understanding the impact of the work. So, for example, with Nurse Family Partnership, I had a chance to talk to a mom who went through the program. This is very similar to, to a lot of our program participants, but young, pregnant, didn't have a lot of support. Her husband was going to jail. And somehow, and it came through her social worker, through her OBGYN office, she got connected to an NFP program in her community, and she said it changed her life course. And her nurse, and again, we talk about the benefits of prevention, saw her for who she was, right? Saw her, respected her non-judgmentally, picked her up off the floor, and at the end of the day, helped her advocate for herself and be able to speak up, so much so that she said that she wouldn't have the career she had, she wouldn't have the family that she had. But what struck me after I talked with her was what she shared, what she learned about herself. And she learned she was more than a mom, she was a successful woman, and that she mattered. And that last part was really important because she wasn't in that place 2 years prior. And now, because we see with prevention programs the multi-generational benefits that happen, not only is she better off, but because the nurse went to the jail to help the father understand what a good dad looks like, helps the transition back to when he did come back to the family. So the health and well-being of that unit, right, is not only improving, but then what does that leave for the child as the child grows up, right? To be now in an environment where it's healthier, right? And there's a sense of self-efficacy and knowing that you do matter, and then knowing you do have a voice. And there was a very similar story with a child first when I talked to a caregiver, and she was young, she was going through depression, juggling a lot, trying to make ends meet. But at the end of the day, she realized that she was learning how to be with her kid, but learning how to be with herself. And that learning about and being with was so important because it helped her make better choices that were not just about herself, but with herself, and then thinking about how is that impacting her child. Really creating the resilience within that family and with her, and breaking that cycle through trusted relationships. And so these programs really have a pivotal impact on these families in terms of not only how they think about themselves, but how they think about what's impacting the family itself.
Those are some powerful stories. Thank you so much for sharing them. Help us see your vision for what prevention models like Nurse Family Partnership and Child First sit inside of healthcare over the next 5 years.
Yeah, it would be great, and we work with a lot of health systems, but if there was an opportunity, because if you think about the healthcare systems now and the complexity of it, and the states that need to now make really hard decisions about budgets and how that could impact the supports in the system. Having prevention as part of the infrastructure in healthcare and working collaboratively, thinking about the whole patient instead of thinking about it as a sort of a sick treatment program, but thinking about it, how do I help make the population healthier, and how do I make the patient healthier overall? And being able to do that, and because there's so much research and evidence that points to how pivotal early intervention impacts human development going forward. So bringing that into the infrastructure of the healthcare system early on and working collaboratively together then helps ensures that you're really looking at the whole family, and you're looking at it beyond that small moment in time where you see a patient, right, and becomes very transactional. We've talked to so many of our clinician and our nurses that say that they join a program like ours because not only they're going back to their community, but they're going back to practicing at the top of their license. And it's about having impact with, you were based on your clinical experience, right, Christine, and being a social worker, right? Being able to use that in a way where, again, at the end of the day, who you're talking to, you make them feel like they matter and they're heard and that they're valued. And so they do make better choices, right? And they have somebody that they can depend on. So being able to bridge that together with not only the primary care or whoever they're working with in the health system, but to ensure that they're looking across those social supports, and prevention is part of that infrastructure.
Some argue that prevention is nice to have when you have a very tight budget. I mean, just speaking plainly, to the moment that we're in and with of massive Medicaid cuts. What do you say to that belief?
Yeah, I think I hear this, where programs like this are sort of this invisible safety net, right? It's a nice to have. Oh, it'd be great to have to be able to get in early. But again, if you tribute it and you ladder it up to a strategy and to ROI and to impacts on costs that it is having on the system and for hospitals in general, it's a good investment. It's a smart investment because you're not only ensuring the health and well-being of who you are taking care of, but you're ensuring that they are set up early on, right, to be able to advocate and make good choices for themselves to avoid further ER visits and accidents and injuries and child prevention service, child services. So all of those costs, they will catch up to you afterwards. So everything that you're trying to do to impact better outcomes, you're actually working against the possible system and to be more holistic and prevent that from getting even more expensive. So there's profit to it if you think about it from a business model perspective.
Well, especially in the same context with value-based care still
Yeah.
moving full steam ahead. Do you position nurse-family partnership as margin defense?
Yeah, value-based care, which certainly support, is really relationship-based care, right? I mean, that's the beauty of it. And it's about ensuring that we're managing not only current patients and clients better, but also preventing that higher cost before they happen. And so that translates to profitability for systems, that the ROI at a societal perspective. So absolutely, payers who really understand this and states that understand this, I think in the next decade they'll be able to master prevention at scale. It's not just the churn of the transactional treatments, right? It actually, again, as I said, to see the systems change is shifting the conditions that hold the problem in place. Right now, healthcare is very expensive. Right now, there's a distrust with the system. There's a research study. It's called the Edelman Barometer, Trust Barometer, and it comes out every year. And it's been a very similar story around increasing distrust of our healthcare system and the providers in the healthcare system, grievances around those big systems, and especially now. And so this is an opportunity to really leverage, and especially to be able to leverage what we know works and what we see as documented ROI, and to be able to include that as part of the infrastructure and then be able to scale that. I mean, that you're scaling prevention, which is exactly what should happen if we're looking upstream to have systems change, because then you're changing again the conditions that are keeping those problems in place.
And I happen to notice in your background that you do know a thing or two about resilience during crises. If we can take it back for a minute and talk about your time at the Red Cross, did that sort of shape the way that you look at Medicaid cuts and system fragility today, and through that lens of resilience?
Yeah, we used to say at the Red Cross that we were there on somebody's worst day, right? And very appropriate in terms of response. But there is a piece of the Red Cross that is about prevention. And for example, 70% of the crises that the Red Cross addressed were like home fires, right? It's about, prevention and understanding what that means. And so it's very similar in terms of, instead of being reactive to a problem and having to band-aid that problem until you can figure out a longer term solution. Why not be preventative ahead of time? And it's just like our personal care, right? We should be doing our annual visits, right? We should be focusing on prevention so we don't have to continue to go back to the doctor or go back to the hospital, right? It's a similar philosophy. But these are families that don't have a lot of support around them, right? And are swimming in that deepest end of the ocean. And so, how can you bring them along? Because I know that children and families are moving farther away from opportunity, especially now. And, our communities are becoming more under-resourced and more underserved. And so, how do we bring children and family back towards opportunity? And it's through ways and access to care, right? Being able to have those opportunities to be able to address issues up front, trusting who you're addressing those issues with, and feeling like they have your back, right? That you are important, that you're heard, and that you're valued. And so home visiting is a prevention and intervention model, is part of that solution to be able to shifting those conditions to change the problems that are in place that are going to impact where families go later on. So they are not less healthy. They have less opportunity. They have less opportunities, children to go to school and to go to school healthy. So there is a trajectory, absolutely, by thinking of it as child poverty is family poverty. That connection is very strong. And so thinking about it from that particular lens, and at the end of the day, how it can impact school readiness, for example. So child poverty costs this country almost $1 trillion a year annually. And so let's say if you can visualize a kindergarten room, and let's say there's 30 kids in the kindergarten room, 1 in 7 of those kids are experiencing poverty. So they are in households that are really trying to make ends meet, right? They're trying to put food on the table, pay the rent, pay utilities, to cook, to keep the lights on, to keep warm in the winter. That's preventable. That's absolutely preventable if we have an infrastructure in place that addresses those needs earlier.
When it comes to sustaining prevention models, what's your perspective on roles? I'm talking about roles of philanthropy versus the government roles versus payer dollars.
Yeah. Everybody has a role to play. All of those actors have an absolute role to play, but not in a siloed fashion, not in a fragmented fashion. So how can each of us in our roles be greater together and think about solutions that center people, that center place, that center collaboration? And thinking about how that is a unit at a systems level, because none of this is in isolation, right? There's trajectory and there's connections from one point to another. Again, you talk about health, but 80% of health is outside of the doctor's office, right? So there's an interconnection to that. So yes, all those actors have a role to play, but what we could be better at and what good looks like is that we are working together in a collaborative model. And philanthropy has been, we have found that the philanthropy has been so supportive in understanding of this interconnection, and especially around early childhood and how early in childhood impacts the trajectory of overall human development and long-term outcomes from a health perspective, from a social perspective, from an educational perspective. So we're really appreciated for philanthropy and understanding the importance of the interconnection.
Well, you certainly know a lot about interconnection. I think I saw Change It was in about 40 states.
Yeah. So what Change It looks like with our 2 programs, we've served over 400,000 families since inception. We have about 300 partners in the field that implement the program as direct service to those communities and families, and that's who we listen to, because we could never know at a national level what they know at a community level. So those partnerships are so important. In 39 states, U.S. Virgin Islands, Washington, D.C., Puerto Rico, and several tribal communities as well. So we're really proud of it.
I think I just saw an expansion a couple of months ago in Tucson.
Yeah, North Carolina, we've had a big expansion there. Right now, with what is happening in our environment, the front line is now the states, right? It really is. And states are under a tremendous amount of pressure to balance their budget, but also to be able to address supports that impact their constituents. And so, we have a robust advocacy and public affairs team, really focusing on how do we shore up support at the state level, because that's where the front line is now, and being able to ensure that speaking with our partners, because they know their communities the best, and how we can walk alongside them and support them at a national level and be able to tell the story, and especially from an ROI and impact perspective, because the outcomes and the ROI are both really important to the story.
Absolutely. How do you keep fidelity while you adapt to those local realities?
Yeah. So that's what I was saying, is that, even though our models have over 40 years of, research and evidence, right? We know that that works, but the context of communities and families have changed and will continue to change. And so, how can we ensure that we stay relevant and nimble to that and listen to our communities, our families? They're at the center of our work, to be able to know what works and create some adaptions based on what they need. And so uh, you know, we've been very focused on ensuring that we evolve, staying true to what we know those models are built on in terms of being grounded in evidence, but also trusting our communities and the families that they're serving on what their needs are, to ensure that our education, that our trainings, that our support for them is relevant.
Yeah, definitely a strength. But nurses are in short supply. How do you scale without losing that nurse-led model that you have?
Yeah, yeah. And especially with COVID, right? I mean, that was certainly a challenge for us as well as any organization, when especially nurses were deployed at a national level. And, these are conditions that we can't control. Not only is with nurses and clinicians, and, being a former clinician yourself, but, with teachers, right? With doctors, we have a workforce shortage problem. And so that's where we're walking alongside our partners, where in some communities, how are they recruiting for the nurses and clinicians and care coordinators for the program? And during COVID, we did deploy telehealth, right? Just because we needed to be able to still provide services. So even when COVID hit, we already had been doing that. So we just had to scale that up a bit. I mean, there is a place maybe for telehealth, certainly in terms of access, for if there's a caregiver trying to make ends meet and has to be at a job at a certain point and can't be home for a visit, right? So maybe there's opportunities for telehealth. But at the end of the day, it's really a support versus the relationship that's built by being in person. So in terms of that workforce shortage question, it's a matter of how do we look at partnering with others that are in the community who could be a resource for us. So for example, we have some sites who work with a nurse, for example, but the client maybe wants to have a doula, right? To support what they need. And so will some of our sites not only incorporate the work of the nurse home visitor or the clinician or the care coordinators per the model, but also ensures that we're listening to what the client needs and working with that partner to see if there are opportunities to bring in some of those other resources, such as doula services or something else, to be able to support those families. But at the end of the day, what we have heard is, even with the nursing shortage, what we're hearing is that a lot of our nurses that have come into the program, and when I've talked to them, have said, they were in oncology, or they were in, early pediatrics. And what they missed was they still wanted to be a nurse, but maybe not in that high pressure, stressful situation, or much more transactional, right? They really wanted to be able to develop a relationship. So when you leave the office for 20 minutes, after 20 minutes, and don't see that person maybe for another year, you have that extended time period where you become that source of dependability and trust for your health. And so that's where that it's not one or the other, it's how do they work together.
Why do you believe continuity of care in the home changes outcomes so much more than clinic-based care?
Because a person doesn't always just have one need, right? If you are especially living paycheck to paycheck, are struggling, you certainly may have medical needs or clinical needs, but there may be mental health needs. You may be trying to figure out, how do I get a job while trying to juggle all of this? How do I figure out to set my child up for going to school? Nobody's life centers around one particular need. And that's why, when we think about drivers of health, I think about it as a capital H, because it's not just physical health or mental health, right? It is health of that well-being, health for well-being, and to ensure that that person can thrive. And those social supports are so important. That's why programs like this that really look at a continuum of care and how we at a national level can help support our partners and listening to them, or what are some of those other social supports that are needed in those communities, and how as we as a national office can help support them.
Why do you think that programs like Nurse Family Partnership outlast waves of other models and other organizations that maybe have more innovation hype behind them?
Yeah, I think there's three differences. One is we are a network model, and we are a model that supports what the needs are in the community based on our partnerships, and we're a model that ensures that we're walking alongside it. So that's, I think, really important, because for us to scale our models, we have to really scale through partnerships. We don't just parachute in and tell them, here's what you need, here's what your community, or here's what your family needs. We really don't want to push ourselves in those communities. We really wouldn't it be ideal, wouldn't we want to have communities pull us in to say, we need a program like NFP. We need a program like Child First. And the reason why is because it fits into this continuum of care, some of these other issues that our families needs. And so our job is to ensure that we give those tools, those proven tools, and the resources so we can walk alongside them, and so they can better focus and serve on their communities. The other is, again, is the 40 years of evidence research. And there are so many wonderful potential pilots and new interventions that are out there. I'm looking at the 40 years of research not as sort of old, but really innovative, because we're building off of what we already know works. We're building off of what the outcomes, what we know we want to see in families to improve their health and well-being. And then layer on top of that, what are ways to adapt, to evolve to the community context. And then the third is that we are relationship-based versus technology first. And again, I don't think it's one or the other. There's certainly an intersection and a bridge that can support both. But at the end of the day, can an AI bot or, can technology supplant what looking into your eyes and feeling, seeing your body language really tell you about the health and well-being of that person, and seeing the environment that that person lives in? Right. It's not a one for one, but it's an opportunity to leverage together, and an opportunity to be able to build off of the strengths of both.
If I'm a Medicaid plan leader listening right now, what's one question I should be asking about prevention that I probably haven't yet?
That one question should be, how can I ensure that people are better off? And how you can ensure people are better off is that you ensure, again, that prevention is not about just being compassionate. Prevention is a smart investment for not only your community, but for your society, and for if you're with the health system, if you're with public health. It is a smart investment in terms of the health and well-being of those that you are obligated to serve.
Is there any one metric that I should pay closer attention to when deciding where to invest?
I think obviously the metric around the ROI, right? Because this is documented. There's research that points toward it, that points towards early childhood and why that's important. But also, again, marrying that with the outcomes, 56% reduction in ER visits. How does that translate to the cost of running my health system? 40% reduction in in child services. How does that impact the costs that I see, right, that are happening in the community that I serve? Where can that money can better go and better invest into improving the health and well-being, right? And being more proactive instead of reactive. So that's a looking at the outcomes, but also how does that ladder up to a smart business strategy?
And then if we have funders or healthcare leaders listening right now, what's the one thing that you want them to walk away with remembering about Change In?
Yeah, that at the end of the day, if we want to improve the health and well-being of children and families, looking at how do we help them get a better start in life. And if we can help them get a better start in life and have that leg up to having the life that they dream of, not what we say that they dream of, or public health says that they dream of, but what they define for themselves as their best life, that's the question to ask. Because that's a trajectory that will impact longer term outcomes in the system itself.
Love it. And then the last thing, question I ask every podcast, every episode now is what's the most underrated and overrated thing about healthcare?
I guess I would answer that with a question of, as a society, what would it mean if fragmentation care was over? So no one is left in the margins, right? The strain on the system that we see ends, that every child and family has the resources that they need. And so there is an urgency of now. And if we can become healthier as a society and struggling children and families now become empowered to make their own life choices and chart their life course, then all of the costs that we're paying for bad outcomes will go upstream and for good outcomes. And we can't do it alone. Our organization cannot do it alone. No one organization can do it alone. And so to your previous question is we all have that role to play. And so how do we be better together? How do we learn better together and not create our own problem by existing in our silos, but how do we ensure that fragmentation of care is over? Because at the end of the day, who does it impact? It impacts the patient, client, the mom, the child, the caregiver. It impacts families. And so without a healthy family going forward, then that connection of child poverty is family poverty. We never break that cycle.
I think that's a really great note to leave our listeners with. And thank you so much for your time today. And thank you for your leadership.
Oh, it was so wonderful getting to know you. And I so appreciate, that is the beauty of social media, right? We connected through social media and I learned about Fundable 15. I learned about your story. And so I'm just really grateful that we had this time together.
I am too. Tell us where we can find you.
Changeit.org. So we have all of the information on not only our programs, but our research, where we currently are, and our theory of change. So absolutely come visit it and explore. And, our work is not done. We're rolling up our sleeves, our hearts all in for all of this work. And we look forward to the opportunity to solution with others.
It definitely shows. We'll leave it there.
Thank you so much, Christina.
Thank you. Bye.